Good afternoon. My name is Alex Memorian. And for those of you that follow my educational posts on Instagram and YouTube, I want to thank you for your encouragement. I'm going to try something new today. I want to give you a small session discussing the cases that I post on Instagram. The case that you see here was recently posted on Instagram. And the important finding for you to note is the lesion here next to the ventricle, which shows some calcification and general high attenuation. So in terms of your approach to a calcification, you should be thinking about tumors, you should be thinking about vascular malformations, and there's some other considerations that we'll discuss today. But this proved to be a cavernoma, and this was proven at surgery. So let's talk about calcified intracranial lesions. So as I mentioned, tumors, vascular malformations, these include cavernomas, arteriovenous malformations, and occasionally aneurysms will calcify peripherally. There is a family of diseases called phacomatoses. We'll talk about one in particular, tuberous sclerosis, which is associated with calcification. And finally, just mention post-infection, that after pediatric infections and after even adult infections with granulomatous disease, you'll occasionally see calcifications. Now, if we look at this patient who has this high attenuation lesion in the brain on CT with multiple small calcifications, reasonable to consider this could be a calcified tumor, although if you look carefully, there's another abnormality on the patient's right side. So if we're not sure, we'll get an MR scan. Here you can see this enhancement associated with this lesion. Maybe that's not helpful one way or another, but if you look on the T2 weighted scan, you see this dark rim around the lesion, this variegated or so-called popcorn appearance of this large lesion. And then again, there's a second lesion on the other side. This is a fairly typical appearance, although large, for a cavernous angioma, also known as a cavernoma. This is a classic cavernoma in the sense that you see this complete dark hemosiderin ring around this cavernoma with, again, these multiple areas of high signal intensity within. This has some mass effect, which is not unusual with these larger cavernomas. Now, this is what a cavernoma looks like at autopsy. This is the staining of the brain that occurs associated with the intermittent bleeding of the cavernomas. And these are the dilated vascular channels within the cavernoma. Remember, there is no brain inside of a cavernoma. This is what allows surgeons to take out cavernomas that reach the surface of the brain without risking removing brain tissue along with the resection. Now, if we look at this patient, you can see that there's a larger area of low attenuation with a small area of calcification. This is a typical appearance of a brain tumor, and this proved to be an oligodendroglioma. This is actually some air from the time of the biopsy of the tumor. So how can I tell that this is a tumor and not a cavernoma? Well, again, we don't see the larger area of calcification, and I think in the end, you're going to end up getting an MR scan in a lot of these cases to better characterize them. But again, you want to keep this differential in mind as you approach each of these cases. Now, here's a young patient, and he comes in with seizures, and let's take a look carefully at this. And we'll notice that there is some focal high attenuation in the right hemisphere right here. Now, again, you could wonder whether this is a small amount of blood, this is a small area of calcification, but keep in mind that areas of pooling of blood within blood vessels. So for example, look at the superior sagittal sinus, the density of that compared to that, they're about the same. So we'll get an MR scan in this patient, and you'll notice in this patient that there's a flow void, very much like the flow in the sinus here and the flow in the internal cerebral veins, and then these small serpiginous channels that are associated with it. This proved to be an arteriovenous malformation. So again, another malformation, this one which has a different treatment and management approach than a cavernoma. Finally, we'll talk about this patient, this 15-year-old with seizures, and you can see these calcified masses next to the ventricle. On the MR scan, this actually has some mass effect with obstruction of the ventricle and some enhancement after administration of contrast. This is a patient with tuberous sclerosis and a giant cell astrocytoma. So let's look at these last two cases. So these are both 67-year-old patients. This patient has a calcified mass that looks like it's outside of the brain. This patient has a curvilinear calcification that projects into the brain, but here in the middle fossa. So what should we consider in this patient? Well, this is not even really within the brain. So we want to think about tumors. What's a common tumor that calcifies outside the brain? That would be a meningioma. This other patient, this ring-like calcification, you can see some of the calcification here on the other side. This is a typical appearance for a calcified rim of a cavernous aneurysm. So the answer to the Instagram case is, of course, the cavernoma of the brain. And I hope these additional cases will help you to understand the diagnostic features of a cavernoma. Hope that's helpful in your practice and to your patients.